Throughout the extensive span of my medical career, I have dedicated a significant portion of my clinical practice to a subject that is far too often relegated to the shadows of whispered conversations and societal taboos: the intimate wellness of the mature woman. I have had the profound honor of guiding thousands of female patients through the therapeutic, restorative, and deeply empowering practice of autosexual activity, or what is colloquially known as manual self-pleasure. I want to state clearly from the outset, this work is among the most fulfilling aspects of my profession. In the sterile environment of a clinic, many women arrive with a heavy burden of silence. They present with a complex array of challenges regarding their sexual function, challenges that are often intertwined with their self-esteem, their relationships, and their sense of physical vitality. In a striking number of these cases, the prescription is not a pill or a surgical intervention, but rather a fundamental shift in how they relate to their own bodies. Modifying the approach to self-stimulation is frequently the most crucial component of the therapeutic solution. If you are a woman over the age of 60, 70, or beyond, and you have felt as though the world has stopped speaking to you about your desires, this comprehensive, evidence-based guide is your sanctuary. My name is DrLilyStones. I produce this educational content to serve as a bridge between modern medical science and your personal lived experience. My goal is to assist you in reclaiming your optimal, intimate wellness. Today's presentation is curated specifically for the discerning, receptive ladies who refuse to accept diminishment as a requirement of aging. We are here to talk about greater pleasure, deeper satisfaction, and the achievement of consistent, revitalizing orgasms. I urge you to remain fully engaged as we move through this material. We will cover everything from the microscopic health of your skin to a final technique I call the lighthouse principle, which has proven to be a transformative turning point for women who thought their days of peak sensation were behind them. The philosophy of the second spring. Before we touch the body, we must address the mind. In our youth, we are often driven by a biological imperative, a frantic, goal-oriented energy. But the second spring of a woman's life, particularly post-menopause, offers a different kind of power. It is a period of liberation. You are no longer tethered to the cycles of fertility. You are now free to explore pleasure for the sake of pleasure itself. Many women worry that age-related physiological changes, increased vaginal dryness, thinned tissues, or a slower warm-up time signify a broken system. This is a clinical fallacy. It does not signify the end of your capacity for joy. It simply indicates that your body has moved into a more nuanced phase. It requires a different input to achieve the output you desire. Consider this an opportunity to learn a new, more sophisticated language with your physical self. You have the foundational knowledge. We are now going to add the finer details, the clinical secrets, and the subtle shifts in rhythm that turn a pleasant moment into an unforgettable one. The beauty of this process is its absolute privacy. These techniques belong to you. You can practice them at your own pace, in your own space, without the pressure of a partner's expectations or the ticking of a clock. This is about cultivating a radiant self-intimacy that leaves you feeling more deeply connected to your physical self than ever before. Phase 1, the clinical foundation of preparation. Pleasure is a physiological event that begins long before the first touch. To ensure that your body is receptive rather than reactive, we must establish a foundation of safety and comfort. 1. The micro-landscape, hygiene, and safety. This is not merely about being fastidious, it is about protecting the integrity of your tissues. As we age, the decrease in estrogen leads to a thinner vaginal epithelium. This means the skin is more susceptible to microscopic tears. The hands. Wash your hands meticulously with warm water and a pH-balanced soap. Scrub beneath the nails. Even a tiny jagged edge or a microscopic trace of an irritant can cause inflammation in the delicate genital region. Nail maintenance. Nails should be kept short and filed to a smooth, rounded finish. Jewelry. Remove rings or bracelets. Metal edges and stone settings are common culprits for accidental abrasions that can lead to discomfort or infection. By removing these, you create a safe clinical zone where your body can fully relax without the subconscious fear of injury. 2. The chemistry of glide, advanced lubrication post-menopause. Vulvovaginal atrophy is a common clinical reality. The vaginal walls become less elastic and natural lubrication decreases. The solution is not to try harder or push through, but to work synergistically with your body's current chemistry. Water-based lubricants. These are the gold standard for safety. Look for formulations that are osmolality balanced to match the natural environment of the vagina. Avoid those with glycerin, parabens, or warming agents, as these can sting thinned tissues. Silicone-based formulations, these offer incredible longevity. Because they do not evaporate or absorb into the skin, they provide a silkier, more consistent glide that is perfect for longer sessions. Natural oils, organic, cold-pressed coconut oil is an excellent option for external massage of the labia and inner thighs, though I advise caution for internal use if you are prone to yeast imbalances. A professional warning on saliva. I encounter many patients who use saliva as a quick fix. From a clinical perspective, I strongly discourage this. Saliva contains digestive enzymes that can irritate delicate tissue, it evaporates far too quickly, and it introduces oral bacteria into the urogenital tract, which is a primary cause of UTIs in mature women. You merit a higher standard of care. 3. Neurological priming, the mind-body bridge. Pleasure is a function of the parasympathetic nervous system, the rest and digest state. If you are stressed, your body is in a sympathetic state, fight or flight, which causes the pelvic floor muscles to constrict, effectively locking the gates to pleasure. Diaphragmatic breathing. Spend 3 to 5 minutes practicing deep belly breathing. Inhale through the nose for a count of 4, hold for 2, and exhale through the mouth for 6. With every exhalation, visualize the deep musculature of your pelvic bowl softening and opening. Sensory signaling. Use a small amount of warmed oil, sesame or coconut, to massage your abdomen in a clockwise direction. This isn't just tactile, it tells your nervous system, I am safe, I am being cared for, I am ready to receive. 4. Ergonomics and comfort. Joint stiffness, arthritis, or lower back pain should never be a barrier to intimacy. Propping. Use a small, firm pillow beneath your sacrum, the base of your spine, to tilt the pelvis forward. This makes the clitoris and vaginal opening more accessible. Support. Place cushions under your knees to take the strain off your hips. Hand health. If you have arthritis in your dominant hand, utilize the other or take frequent stretch breaks. The goal is not a marathon, it is a mindful exploration. Phase 2, the 5 transformative techniques. Once the environment is prepared, we move into the actual mechanics of pleasure. Remember, these steps are designed to build upon one another. Technique 1, preliminary stimulation, priming the canvas. One of the most frequent clinical errors I see is rushing to the finish line. In your 20s, you might have gone straight for the clitoris. In your 60s, that approach is often counterproductive. Vasocongestion, the process of blood filling the genital tissues, takes longer now. The technique, begin entirely away from the genitals. Use the flats of your hands to stroke your outer thighs, your hips, and your lower belly. The purpose: this awakens the cutaneous skin nerve endings and begins the slow migration of blood flow toward the pelvic region. The tease: use a piece of soft fabric like silk or your undergarments as a barrier. Apply a pulsing rhythmic pressure with your palm against your vulva. This teasing buildup engorges the labia and makes them more sensitive for the direct touch that follows. Patience here is invariably rewarded with a more intense response later. Technique 2, clitoral awakening, the gentle invitation. The clitoris is an incredible organ containing over 8,000 nerve endings. However, post-menopause, direct stimulation to the glands, the tip, can sometimes feel overly intense or even electric in an uncomfortable way. The technique: focus on the clitoral hood, place your fingertips slightly above or to the side of the clitoris, perform minute circular motions, think smaller than the size of a dime, the clock. Method: imagine a clock face on your vulva. Touch lightly at 12, then 3, then 6, then 9. This stimulates different nerve bundles and prevents any single area from becoming numbed by repetitive motion. Biofeedback: pay attention to your breath. If your breathing shallows or catches, you are hitting the right mark. If you feel a sharp sting, you are using too much pressure. Broaden your touch by using the flat pad of your finger rather than the tip. Technique 3, intravaginal exploration, the architecture of fullness. For those who enjoy internal stimulation, the goal is not thrusting, but rather exploration. The entry, after applying ample lubricant, rest your finger at the vaginal opening. Take a deep breath and wait for the melting sensation of your muscles relaxing. The come hither motion, insert one finger and gently curl it towards your belly button. You are looking for the anterior wall of the vagina. Clinical insight: the vaginal canal is not a simple tube. It is a complex architecture of folds and sensitive zones. Use your finger's ability to bend and articulate to find the specific angles that create a sense of internal fullness. If you encounter any dryness, stop and reapply lubricant immediately. Technique 4, the G-spot blended symphony. The area colloquially known as the G-spot is actually the urethrovaginal sponge. When you are highly aroused, this tissue becomes engorged and more textured. The integration. This is where we combine external and internal touch. While one finger maintains a steady, internal tapping or curling motion against the anterior wall, use your other hand or your thumb to continue the circular motions on the clitoral hood. The synthesis. For many women over 60, this dual input is the magic key. It creates a blended sensation that feels much deeper and more holistic than clitoral stimulation alone. It resonates through the entire pelvic floor. Technique 5, the lighthouse principle, the final threshold. This is the most important clinical secret I can share. As women approach the moment of climax, there is a natural tendency to get excited and change the rhythm, the speed, or the pressure. To the nervous system, this is like a sudden interruption. The logic: your brain needs consistency to cross the threshold into orgasm. If you change the stimulus at the last second, the wave often breaks before it reaches the shore. The action. Once you find the specific stroke or rhythm that makes your body say yes, you must become a lighthouse. A lighthouse doesn't flicker or change its pattern, it stays steady and unwavering. The threshold: keep your pressure, your speed, and your location exactly the same. Do not go faster, do not go harder, stay the course. Breathe into the sensation and let the wave crest naturally. This steady approach is why many of my patients find their orgasms in their 60s to be more profound than those in their youth. Phase 3, the sacred afterglow resolution. In our fast-paced world, we often finish and immediately reach for our phones or get out of bed. This is a missed clinical opportunity. Following a climax, or even a session of deep pleasure without climax, your body is flooded with oxytocin, the cuddle hormone, and prolactin. This neurochemical cocktail is a powerful antidote to cortisol stress. The integration: lie still for at least 5 minutes. Place your hands on your heart and belly. Feel the thrum of your circulation as it returns to its baseline. The affirmation. This is the moment you solidify the connection with your body. It is a time for self-gratitude. You are reminding yourself that you are a sensory, vital being, regardless of what a calendar says. A final clinical thought. I often hear women say, "I thought that part of my life was over." I am here to tell you that your capacity for pleasure is a lifelong gift. It is a physiological system that requires maintenance, certainly, but it never truly expires. The techniques I've shared: preliminary priming, clitoral awakening, internal exploration, blended stimulation, and the lighthouse principle, are more than just moves. In Double Innie, they are a map back to yourself. They are a way to navigate the changes of aging with grace, curiosity, and an unapologetic demand for joy. Intimate wellness is a pillar of overall health. It improves sleep, boosts the immune system, and fosters a sense of psychological resilience. You are not acting like a teenager, you are acting like a woman who understands her worth and the complexity of her own design. If this guide has sparked a realization or a question, I encourage you to share your thoughts in the comments below. We are building a community where the mature woman's experience is centered and celebrated. Your journey of rediscovery starts today. Remember, your body's history is not a closed book. It is an ongoing narrative, and you are the author of its most pleasurable chapters.